بسم الله الرحمن الرحيم. محاضرتنا اليوم في مادة General Anatomy هي آخر محاضرة لهذا الكورس. cranial nerves. حقيقة cranial nerves هي من ضمن النمو العصبية أو تقال neuro science. فلهذا the cranial nerves have 12 pairs of cranial nerves arise from the brain inside the cranial cavity and passes through various foramini in the bones of the cranium. Means that are passage of the cranial nerve from the brain to the foramen within the skull of bone. Divided into three functions. There are three functions for a cranial nerve, either sensory nerves or motor nerves or mixed sensory and motor nerves. The cranial nerves is a number, is Latin number, means the 1, 2, 3, 4, as you see in this figure. The first one called it olfactory nerve, second one called optic nerve, the third one called oculomotor nerve, fourth one called it trochlear nerve, fifth one called it trigeminal nerve, sixth one called it abducens nerve, seventh one called it the facial nerve, eighth one called it vestibulocochlear nerve, ninth one called it glossopharyngeal, 10th vagus, 11th accessory, and the last one, 12th cranial nerve is hypoglossal nerve. This is the all cranial nerve in the skull. This figure shows the location of each cranial nerve within the brain, its origin, and its course within the cranial cavity. We start with the first one, is called it olfactory nerve, the first cranial nerve. The olfactory nerve, it is a sensory nerve. It is a pure sensory nerve. It contains axons that conduct impulse from olfaction, the sense of smell. The olfactory epithelium, that is its location within upper the roof of the nasal cavity within the olfactory mucosa that occupies the superior part of the nasal cavity, covering the inferior surface of the piriform plate and extending down along the superior nasal conchae and the middle of the nasal septum. The course of olfactory nerve. We start with the mucosa, olfactory mucosa that contains the nerve end of the first cranial nerve, called it fascicles of olfactory nerve. These fascicles that transmit through opening with the cribriform plate of ethmoidal bone, this that all joint and forming olfactory pulp. And then the olfactory pulp that transmit olfactory trunk and go to the brain. The olfactory receptor within the olfactory epithelium are bipolar neurons. Each has a single odor sensitive dendrites projecting from one side of the cell body and an myelinated axon extending from the other side. The bundle of axons of olfactory receptor extends through the about 20 olfactory foramini in the cranial plate of the ethmoid bone, as you see in this figure. The olfactory nerve ends in the brain in paired masses of gray matter called olfactory pulps, two extensions of brain that rest on the piriform plate. Within the olfactory pulp, the axon terminals of the olfactory receptor form synapse with the dendrites and cell bodies of the next neuron in olfactory pathway. The axons of this neuron make up of olfactory tract, which extend posteriorly from olfactory pulps. Axon in the olfactory tract in the primary olfactory area in the temporal lobe of the temporal cerebral cortex. The second cranial nerve is optic cranial nerve. This nerve is a pure sensory. It contains axons that conduct nerve impulse for vision. In the retina, there are rods and cones initiate visual signal and rarely named to bipolar cell, which transmit its signal to ganglion cells. The axon of all ganglion cells in the retina of each eye join to form an optic nerve, which passes through the optic foramen. This figure shows the course of optic nerve from the retina of inside the eye, and then that forms the optic nerve, and this optic nerve joins on right and left side in the center of the brain between two hemispheres of the cerebrum, thus forming optic chiasm, and from optic chiasm that branch to two tracts, call it optic tract, and then go to the occipital area of the cerebrum that end as of nerve. So, to posterior to eyeball, the two optic nerves merge to form the optic chiasm. Within the chiasm, axon from the medial half of each eye cross to the opposite side. Axon from the lateral half remain on the same side. Posterior to the chiasm, the ray-grouped axons come from each eye from optic tract. Most axons in the optic tract end in the lateral geniculate ganglia of the thalamus. There, they synapse with a neuron whose axon extend to primary visual area in the occipital loop of cerebral cortex. A few axons pass through the optic chiasm and then extend to superior colliculi of the midbrain. They synapse with the motor neuron that control the extrinsic move the eyeball and intrinsic eye muscle control light intensity. This figure shows the course of the optic nerve from the retina to the optic nerve to the chiasmus that transmits to the optic trunk and to the visual area of the thalamus, and from the visual area of the thalamus go and end with the visual cortex in the occipital loop of cerebrum. The third cranial nerve is called oculomotor nerve. The oculomotor nerve is a pure motor nerve to the muscle of the eye. The oculomotor nerve extends anteriorly and divided into superior and inferior branch, both of which pass through the superior orbital fissure into the orbit. The axon in the superior branch innervates the superior rectus, the one of extrinsic eyeball muscle, and the levator palpebrae superioris muscle of the upper eyelid. The axon in the inferior branch supply the middle rectus, inferior rectus, and inferior oblique muscle, all extrinsic eyeball muscles. This somatic motor neuron control movement of the eyeball and upper eyelid. The inferior branch of oculomotor nerve also provides parasympathetic innervation to intrinsic eyeball muscle, which are smooth muscles. They include the ciliary muscles of the eyeball and the circular muscle sphincter pupil of the iris. The parasympathetic impulse propagates from oculomotor nuclei in the midbrain to the ciliary ganglion, a relay center of the autonomic nervous system. From the ciliary ganglion, parasympathetic axon to ciliary muscle, which adjusts the lens for near vision. Other parasympathetic axons stimulate the circular muscle of the iris to contract when bright light stimulates the eye, causing decrease in the size of pupil that lead to constriction of the pupil. This figure shows the course of oculomotor nerve from within the midbrain and enter to superior orbital fissure and its two branch, superior and inferior branch, that supply the extrinsic muscle of the eye and the intrinsic muscle of the smooth muscle of the eyeball. The oculomotor nerve is proprioceptive sensory axon from extrinsic eyeball muscle being their course toward the brain and the oculomotor nerve, but eventually leave the nerve to join ophthalmic branch of trigeminal nerve. They do not return to the brain in the oculomotor nerve. The cell bodies of sensory axon rise in the trigeminal ganglion, and they enter the midbrain via trigeminal nerve. This axon conveys nerve impulse for proprioception, the non-visual proprioception of movement and position of body from extrinsic eye wall muscles. The fourth cranial nerve, called it trochlear nerve. The trochlear nerve is a pure motor nerve. It is the smallest cranial nerve, arises from posterior part of brain stem. At its course is short course, and the trochlear nerve is motor neurons originate in the trochlear nucleus in the midbrain, and axon from nucleus pass through the superior orbital fissure of the orbit. This somatic motor axon innervates the superior oblique muscle of the eyeball. This is one of extrinsic eyeball muscles that control movement of the eyeball. Proprioceptive sensory axon from the superior oblique muscle begin their course toward the brain in the trochlear nerve, but eventually leave the nerve to the joint ophthalmic branch of trigeminal nerve. They don't return to the brain in the trochlear nerve. The cell body of sensory nerve rise the trigeminal ganglion, and they enter the midbrain via trigeminal nerve, like the third cranial nerve. This figure shows the course of the trochlear nerve from the pons, midbrain, and go a short course within the cranial cavity and enter to the orbital cavity through superior orbital fissure and supply the superior oblique muscle. The trochlear nerve, like those of the oculomotor nerve, third cranial nerve, this axon conveys nerve impulse for proprioception, the non-visual perception of the movement and position of the body from extrinsic eyeball muscle. The fifth cranial nerve حقيقة هو أهم cranial nerve بالنسبة لطبيب الأسنان هو trigeminal nerve. حقيقة trigeminal nerve مسؤول على الانnervation of the whole face and the head. So we divided the trigeminal nerve to three parts. I call it first one ophthalmic nerve, second one maxillary nerve, and third one mandibular nerve. So this three division of trigeminal nerve. The trigeminal nerve is mixed nerve, so it is sensory and motor nerve. It is largest cranial nerve. They have two roots from ventrolateral of the pons, have large sensory root and small motor root. That is forming the trigeminal nerve. So the large sensory root has a swelling part in trigeminal ganglia. The trigeminal ganglion located in the fossa inner surface of the trans portion in the anterior surface that within the middle cranial fossa. The trigeminal ganglion contains cell bodies of most of primary sensory neurons. We have small motor root originate from nucleus in the pons of the midbrain. The trigeminal nerve have three branches: ophthalmic, maxillary, and mandibular division of trigeminal nerve. This figure shows a color the sensory branching of the trigeminal nerve. The green one is called it ophthalmic zone, the red one called it maxillary zone, and the blue one called it mandibular zone. So three zones are supplied by three divisions of trigeminal nerve. We start from the first division is ophthalmic branch. It is the smallest branch of trigeminal nerve, interorbit through superior orbital fissure, that contain sensory axon from the skin over upper eyelid, the eyeball, the lacrimal gland, upper part of nasal cavity, the side of nose, forehead, anterior half of the skull. That it is the sensory innervation to the ophthalmic nerve. The ophthalmic nerve divided to three branching. First one call it frontal, and the second one call it sensory, and the third one call it lacrimal. The frontal branch that enter through the supraorbital fissure and then supraorbital notch that is going to supply to have divided two terminal branch, call it supraorbital branch and supratrochlear branch. The nasociliary nerve that it is branching to long ciliary nerve, short ciliary nerve, nasal nerve, ethmoidal nerve, and infratrochlear nerve. And the lacrimal nerve that supply the lacrimal gland. This figure shows the ophthalmic nerve and its division within the orbit and outside and the nose and outside of the within the face and the scalp. The second one, called it maxillary division of trigeminal nerve or second division of trigeminal nerve. It is intermediate in size. It is larger than the ophthalmic nerve but smaller than the mandibular nerve. Enter the foramen rotundum of the sphenoid bone. Contain sensory axon from mucosa layer of the nose, palate, part of the pharynx, upper teeth, upper lip, and lower eyelid. This is innervation by the maxillary division of trigeminal nerve. This figure shows the branching of maxillary nerve through the trigeminal ganglion that have give maxillary division of trigeminal nerve, and through foramen rotundum give the nervus of thyroid canal, we got palatine ganglion, palatine nerve, and posterior superior nerve, and then pass to the posterior to the maxillary body and enter through foramen inferior orbital fissure and then to inferior orbital canal that give a branch as posterior middle superior aerial nerve, and then enter to the groove, orbital groove that give the anterior superior aerial nerve, and go through the infraorbital foramen and give a terminal branch of infraorbital nerve, this division of trigeminal nerve. The third branch, the third division of trigeminal nerve, called it mandibular division of trigeminal nerve. It is the largest nerve of trigeminal nerve. It is through foramen of valley of sphenoid bone. Contains sensory axon from the anterior two-thirds of the tongue, cheek, and mucus deep into it, lower teeth, skin over the mandible and side of head, anterior of the ear, mucosa of floor of the mouth. The sensory axon from three branch enter the trigeminal ganglion and terminate in nuclei in the ponus. The trigeminal nerve also contains sensory fiber from proprioceptor located in the mucosa of mastication, muscle of mastication. This figure shows the branching of the anterior nerve that go through within the trigeminal ganglion, the mandibular division, enter through foramen ovale and divided into branch, anterior branch and posterior branch. The anterior branch is mainly motor that gives the muscle of mastication and the posterior view of the gastric muscle. And we have only one sensory nerve that is long buccal nerve. And the posterior branch that is mainly sensory except one motor branch that it is inferior aerial nerve and lingual nerve is sensory nerve, and we have mylohyoid nerve that supply the mylohyoid muscle and anterior view of the gastric muscle. The somatic motor axon of trigeminal nerve are part of the mandibular nerve and supply muscle of mastication, masseter, temporalis, medial, lateral pterygoid, anterior view of the gastric, and mylohyoid and tensor tympani. The important control of chewing movement. This figure shows the motor innervation and the terminal branch of it within the mandibular division of trigeminal nerve. The sixth cranial nerve is adjacent nerve. It is pure motor nerve. Its origin from Aegis nucleus of the fonus. It is somatic motor axon extends from nucleus to the lateral rectus muscle of the eyeball through the superior orbital fissure of the orbit. Its nerve impulse causes abduction of eyeball. The adjacent nerve proprioceptive sensory axon from the lateral rectus muscle being their course toward the brain in the adjacent nerve, but eventually leave the nerve to join ophthalmic branch of trigeminal nerve. They don't return to the brain in the adjacent nerve like the third and fourth cranial nerve. The cell body of sensory neurons right in the trigeminal ganglion, and they enter the midbrain via the trigeminal nerve. This axon conveys nerve impulse for proprioception, the non-visual precipitation of the movement and position of body for extrinsic eyeball muscles. The seventh cranial nerve it is also important for the dentist. حقيقة الفيشل nerve هو مهم لأنه يتعلق بالمصل of facial expression. The seventh cranial nerve is the facial nerve. The facial nerve is mixed nerve, means sensory and motor nerve. The sensory axon extends from the taste bud of the tongue anterior to third to the geniculate ganglion, a cluster of cell body of sensory neurons that lie besides facial nerve and end in the fonus. The sensory portion of facial nerve also contains axon from receptor in muscles of the face and scalp from skin in the ear canal. The axon of somatic motor neurons arises from nucleus in the fonus, pass through the vitreous portion of the temporal and innervation facial scalp neck muscles. Innervation, this axon causes contraction of facial expression muscle plus styloid muscle, posterior belly of digastric and staphylocochlear in the ear. The axon of parasympathetic neurons that are part of the facial nerve end in two parasympathetic ganglions. First, call it pterygopalatine ganglion, and second, called submandibular ganglion. From these two ganglia, other parasympathetic axons extend to the lacrimal gland, nasal gland, palatine gland, sublingual gland, and submandibular salivary gland. The eighth cranial nerve that related to here, call it vestibulocochlear nerve, or call it auditory, or call it acoustic nerve. This is the eighth cranial nerve. The vestibulocochlear nerve, it is acoustic as auditory nerve. So it is sensory nerve, pure sensory nerve. Have two branches, vestibular and cochlear branch. The vestibular for the vision and cochlear. Vestibular for hearing and for balancing of the body. This figure shows the course of the vestibulocochlear from the vestibule to the vestibular ganglion and the vestibular nerve forming and the cochlear nerve and joint forming the vestibulocochlear nerve. The vestibular branch of the vestibulocochlear nerve carry impulse from equilibrium. The sensory axon and the vestibular branch arise from semicircular canal and the saccule and utricle of the inner ear, then extend to the vestibular ganglion, where the cell body are located, and end in the vestibular nuclei in the medulla oblongata. Some sensory axon enter the cerebellum via the inferior cerebral peduncle. The cochlear branch of this branch carries impulse for hearing. The sensory axon in the cochlear branch arises in the spiral organ of Corti, in the cochlea of the inner ear. The cell body of cochlear branch sensory neurons are located in the spiral ganglion of cochlea. From this axon extend to the cochlear nuclei in the medulla oblongata. This is the cochlear branch of the vestibulocochlear nerve. The ninth cranial nerve is glossopharyngeal nerve. It is again mixed nerve, means sensory and motor nerve. The sensory axon of glossopharyngeal nerve arises from the taste bud and somatic sensory receptor on the posterior third of the tongue, proprioceptor in swallowing muscle supplying by motor portion, parareceptor in the carotid sinus, and chemoreceptor in the carotid body. So it is mixed cranial nerve. The cell bodies of this sensory neuron are located in the superior and inferior ganglia. From this ganglia, sensory axon passes through the jugular foramen and ends in medulla oblongata. The axon of motor neuron in glossopharyngeal nerve arises in nuclei of the motor and exits skull through the jugular foramen. The somatic neuron invades the stylopharyngeus muscle, and autonomic motor neuron parasympathetic stimulate the parotid gland to secrete saliva. Some of the cell bodies of parasympathetic motor neuron are located in the optic ganglion. This figure shows the course of glossopharyngeal nerve inside the cranial cavity and outside of the cranial cavity. The 10th cranial nerve is the vagus nerve. The vagus nerve is mixed nerve. The sensory axon arises from the skin of external ear, a few taste buds in the epiglottis and pharynx, proprioceptor and muscle of the neck and throat, parareceptor in the arch of aorta, chemoreceptor in the aortic bodies, visceral sensory receptor in the most organ of the thoracic and abdominal cavities. These axons pass through the jugular foramen and end in the MO and ponus, medulla oblongata and ponus. The somatic motor neuron arise from the nuclei in the medulla oblongata and supply muscle of the pharynx, larynx, and throat palate are used in the swallowing and vocalization. The axon autonomic motor neurons, parasympathetic, and the vagus nerve originate in nuclei of medulla oblongata and end in the lung and the heart. The vagal parasympathetic axon also supplies the gland of the gastrointestinal tract and smooth muscle of the respiratory tract, esophagus, stomach, gallbladder, small intestine, and most of large intestine. The 11th cranial nerve is accessory nerve. The accessory nerve is pure motor nerve. The motor axon arises in the anterior gyrate of the fifth segment of cervical portion of the spinal cord. The axon from the segment exits in spinal cord laterally and come together, pass through foramen magnum, and exit through jugular foramen along with the vagus nerve. The accessory nerve conveys motor impulse to the sternocleidomastoid and trapezius muscle to coordinate the head movement. The sensory axon in the anterior accessory nerve originates from the proprioceptor in the muscle supplied by its motor neurons, being their course toward the brain in the accessory nerve, but eventually leave the nerve and to join to the cervical plexus. From cervical plexus, they enter the spinal cord via the posterior root of the cervical spinal nerve to pass and end in the medulla oblongata. The sensory axons do not return to the brain in the accessory nerve, and like all sensory axons, have their cell bodies in the posterior root ganglion. This figure shows the course of accessory nerve intracranial and in the extracranial part. The last word cranial nerve is hypoglossal nerve. It is pure motor nerve. The somatic motor axon originates in the hypoglossal nuclei in the medulla oblongata, pass through hypoglossal canal, and supply the muscle of the tongue. This axon conducts impulse for speech and swallowing. Sensory axons that originate from the photoreceptor in the tongue muscle begin their course toward the brain in the hypoglossal nerve. They leave the nerve and join cervical spinal nerve and end in the medulla oblongata, again entering the central nervous system via posterior route of cervical spinal nerve. The sensory axons do not return to the brain in the hypoglossal nerve. This figure shows the course of the hypoglossal nerve until reached to the muscle of the tongue. This figure again shows the course of the fibers that go to the muscle of the tongue. Thank you for your listening to this lecture.